everybody, Dr. Rob Silverman here. We're doing our Facebook Live. Yesterday we had Lawson Aschenbach on a taped Zoom. A lot of great feedback, pro race car driver, good guy, Crohn's disease. Love to hear the feedback on that. Today, we are without question going to answer all your health questions and all your health questions about the health pandemic. We've been getting a lot in my inbox and everything, and I picked out a whole bunch, and there's more. So those who are just tuning in, and as you tune in every few minutes, I'm going to say, write a question that you have about health, about a health pandemic, and I'm going to be very, very happy to answer it. These are really interesting questions, and some of which I really appreciate asking about me and what we're doing and things of that nature. So as always, I want to let you know, I'm sure he'll pop on. We've got Creator Chiropractic in Medford, Oregon, Dr. Mike's Powell and Mike's Warren. I'm pretty sure my friend from 8 Weeks to Wellness, Dr. Dane Donahue, will come in and out. He's a busy guy. He's probably in the office saving lives and changing lives. You change a life to save a life. And I'm sure Veronica Hope at some point, she does a great job over the pond. She'll be checking in. So we've got all our tremendous affiliates. We're doing a great job. I know Dave D'Angelo sent me a nice little Purity coffee. I do appreciate that. Mamie's still waiting for the grinds. She's waiting for the grinds, man. She's getting a little tired of the grinding the thing, but love the coffee anyway. Little inside joke between a good old friend for the last 15 years or so. In any case, if you have any additional questions, feel free to ask. I'm very happy to answer everything. Let's start off with the first question that caught my attention. What is it about mild or asymptomatic cases of COVID-19? And I think what the person meant was, how common is it mild or symptomatic? Well, we know, and the data is probably changing a lot, that about 25% of people are symptomatic. Now, 370 people in a meatpacking plant, I think it was a pork packing plant to be accurate, in Missouri, were supposedly all symptomatic. There's been no follow-up. So, having said that, I believe that asymptomatic number may increase as we continue to expand the testing. So most people that I know have felt a flu, and a pretty virulent flu. It hasn't been anybody that I've tested, small sample size, there's millions of people, we haven't even got into thousands that I've done, although KBMO was in the thousands, that everybody knew that they had it. As a matter of fact, there are some people who thought they had it and were, as you know, a little disappointed. So there are mild and asymptomatic. It is not uncommon. I think we're going to find it to be more common as we continue to test. And that, if you got to get it, be asymptomatic, get your antibodies, kumbaya, if you will. How is COVID-19 diagnosed? Well, there's a couple of different ways. Number one is you have the PCR test, which is a swab. They stick it pretty high up into the back of your nose, a little uncomfortable, and that tests to see if you have any viral particles. That can be, if done properly, a very accurate test. That will tell you at the time if you're positive or negative. Now, it's very interesting if I could show the curve at some point when you also can test for antibodies. So having said that, the antibodies, there's two in particular that you want to look for. IgM, which comes out earlier, and IgG, which comes out later. So what you're going to see is you're probably not going to see any symptoms in about the first 5 days. We all know it's 2 to 14 days, but the median average is 5.1 days. And then you're going to see, most probably, if you have a symptom, a spike in fever, a spike in a cough, and you're going to not feel well, you're going to have a lot of fatigue. So that's going to go up, and IgM is also going to start. At some point, you're going to see the drop in your symptomology, and you're also going to start to see the drop in IgM. At that point, you're going to see a rise in IgG, kind of day 14 to 21, IgM 7 early to 21, IgG 14 to 28. So it really depends when you get the test, which one will be more indicative of where you are in the process. So having said that, you have the PCR, you have the antibody test, and the antibodies now are finger stick. They have rapid tests, 15 minutes, and there's also serum blood tests. What are the risk factors for a more severe disease? We're actually referring to these risk factors now as comorbidities. So some of the more common comorbidities would be obesity, hypertension, diabetes, cardiovascular disease, autoimmune diseases. Those 5, there are others. You can make the case that they're all lifestyle oriented or impacted by a bad lifestyle or impacted positively by a good lifestyle. So a lot of these comorbidities are issues. In addition, some other ones may be age. So when we talk about age, we've really depicted age as we get older, our immune system decreases, immunosenescence. So clearly we want to reinvigorate, rejuvenate, support, balance our immune system. So some of the other risk factors clearly would be if you have problems with your liver, problems with your kidneys, you have a pre-existing lung problem. So if I missed any, those are the ones that really truly come to mind or at the top of my consciousness. Another one that I would love for them to add, but I haven't seen them add, is something damage to the gut, or if you will, leaky gut or increased intestinal permeability. Without question, I've seen a tremendous amount of people who have a problem with the gut. So what I'm doing is many non-patients have reached out to me for the antibody test. We've taken the antibody test, and then when they've come back positive for, say, IgM, IgG, wherever they are, most are IgM negative and IgG positive. If they're positive, we've been running some lab tests, and surprising, most of these people, if not virtually everyone, has had a leaky gut or a problem with intestinal permeability. So I believe that that's a critical element. We've covered that a multitude of times. People should be well versed in the idea of 80% of your immune cells are in your gut. You really have to do everything to take care of your gut. Everybody should understand that the gut health and gut integrity is a critical element. Another question that I liked: what are potential therapeutic options for treating the virus? And I think that they were asking me about these options. You're talking about alternative options. Well, really right now, that's all we have. We know that there's a drug, remdesivir, if I said that correctly, it decreases the amount of time that you're in the ICU by 30%. Vaccines, which I really hate to talk about, they're in phase 2, so that's a long way away. So right now, all we really have is alternative, or us. It's still just us. So clearly the alternative is lifestyle. Eat well, exercise, sleep well, hydrate well. When I say eat well, plant-based diet, organic coffee, grass-fed beef, wild smash fish, greens, fruits and vegetables, intermittent fasting. I can't suggest the intermittent fasting enough. Or if you would, time-restrictive eating, 14 hours of a fast, 10 hours of an eating window. In addition, some supplements. I'll give you some 5 basic supplements. You've probably heard these already: zinc, quercetin, omega-3 fatty acids, vitamin C, and nothing better than D3. There was and I know somebody asked a D3 question, so I'll get to that. But those 5, and that's not the only 5. There's others that PEA is something that most people don't know about. They're overlooked. Citrulline is actually a hidden gem, alpha lipoic acid. So we could go on and on and on, probiotics and such. Someone said, talk to me about strengthening our immune system. So interesting, strengthening our immune system. No, we're good. I thought we had something I needed to answer. So strengthening our immune system. Well, one, I always like to emphasize the barriers. Our barriers are our immune system. A great example is wearing the mask. Why do they ask you to wear a mask? Because you need a barrier to your mouth and your nose, oropharynx, to protect yourself. That's a barrier. Your skin's a barrier. Your gut lining's a barrier. Your lung lining is a barrier. The problem with the virus is it has to come in. Remember, you have to invite it in. Once it's in, then the problem is it's unique in that it can damage and get through your barriers and get inside your organs, your muscles, etc., multiple organs at the same time. That poses the problem. So we have a barrier. Then we have an immune system. It's innate, which God gave us, as I've always said, and adaptive or acquired. Now, what's interesting, the innate immune system very simply is a search and destroy. It's macrophages, it's white blood cells, it's neutrophils, and it's going to kill everything. That's where you hope that you end. Then you have an adaptive. The immune system now adapts. It's acquired. You had it over the last 10,000 years, and it recognizes the pathogen and it memorizes it. So how does it memorize it? It creates antibodies. So in theory, by memorizing it, it's never foreign to us again, and our immune system knows how to react the second time after insult, and that's how we build our autoimmunity. It's really simple. So our autoimmunity, that's what they claim the vaccine does. But we have our ability, if our immune system's functioning well, in almost all instances, people who don't have comorbidities, to be able to recognize and memorize and produce it. It's kind of like some people are really good at getting startled. They adapt really well. And others need to go through it one time. And that's the change in our immune systems. And that's how I like to explain it. Barrier, innate, remember, search and destroy, and adaptive. You adapt by recognizing and memorizing. What's different structurally with this virus versus others? So those who say it's just a flu, it's not really just a flu, it's a very unique virus. It's a novel virus because we haven't seen it before, because it came from animal to animal, animal to human, and human to human. So we have no memorization because the genome is different than the previous virus. So having no memorization poses an issue. The other issue is that it has these spiked proteins. Now, we've had spike proteins before, but this one's a triple spike tropism, where it sticks in and it's tighter. It gets in on our receptor sites, our ACE2 receptors, and that's when it poses the issue. It's hard to get off. So we need specific things to be able to stop it and to block what I call the docking sites. The best thing that can protect that docking site from sticking in the spike is EGCG, green tea. So that would be something that I would strongly recommend. 4 cups of green tea, going to upregulate, appropriately balance, support your immune system. So structurally, it's very, very different. And that's why it's so virulent. It's new and it has its structural difference. So that combination is the issue why so many people are feeling sick. The rates of antibody testing. I'm assuming you want to know the rates of people being positive. Well, clearly, depending where you are in the U.S., New York probably being the hotbed, it's about, on the tests that I gave, about 20% of people are showing antibodies. Now, we get people from other parts of the country, it's much less. Somebody told me in Colorado, they use a test, their patients are from Colorado, it's like 8 or 9%. I think as the populace who doesn't feel bad gets tested, I think those rates will go down. But I think that we've been exposed, and I think we'll continue to be exposed. And that's not fear-mongering. We don't have any way of ameliorating it, but we're exposed all the time to all different things. That's what we have an immune system for. That's why we have barriers. It's just that we have to be, when I go to my office, I'm wearing, I can put a picture, I'm all geared up. Vitamin D levels. There's I wish I may even go open up my laptop right now and tell you, it's grassroots. I couldn't remember. It's grassroots. And believe it or not, the prodigious change in a vitamin D level and your symptomology and your rate of occurrence in COVID-19 was tremendous when it was, when it was 30 IUs or more, which isn't a lot, which is not a lot. It's too low. I like it 60. So if you're at 60, you probably have a greater chance. Vitamin D3, 5,000 with K2. So I'll post that. That was from Grassroots. You will love that slide. It's only a level of 30, too low. Yep.
Dave wants to know, how about L-glutamine for protection to the intestinal mucosal membrane?
L-glutamine, the most abundant amino acid. It's great, Dave. The most abundant amino acid in the body. It's great because it helps with mucosal lining. It's also shown to, when it heals the mucosal lining in a very rapid fashion. So L-glutamine is great. That was good. Well, I got her to laugh. L-glutamine is great because not only helps the gut, but it's really good for muscle mass. Good? Fabulous. COVID-19 in the environment. Is there a relationship? It's a good thing I don't have to write notes because my pen just left me. Yes, there's a tremendous relationship with the environment. They've talked about the area and air pollution, 15% increase in the incidence of COVID-19. The environment's a critical element. Think about it. If you're living in a house where you have a lot of room, you could truly isolate. If you're living in a smaller house with multi-generational demographic, and in that multi-generational, you don't have that much space. If somebody's sick, everybody's sick. And we had that in our office. Somebody had talked about that getting sick. So yes, environment is a critical element. The ability to get the foods, it is playing a major role. It was actually a discussion point in many of the articles this morning on COVID-19. What changes do you see in the imminent future for healthcare? Well, I think the medical model is praying for the vaccine, and that's about as much as I'll say. Of course, everybody's looking for a drug because we live in a medically or a drug-oriented nation. But for the imminent future, wow. Well, I think we're all going to have a question with our docs now, and we're all going to say, well, what do I do when the next one comes? Like, what are we going to do for immune health? What do I do to protect against viruses? Wow, I want to protect against bacteria. Wow, the comorbidities and the risk factors were lifestyle oriented. So the question, it's not going to be so much what the doctor is going to do. It's what you ask of your doctors. So I'll give you an example, and hopefully you'll understand the analogy. I take extensive blood work, extensive. And they bring it back to many of my colleagues, and many of the colleagues are very, very disappointed because it's too extensive. Well, if your doctor's not willing to look, and your doctor's not willing to talk beyond the ball right here, it may be time to get a different practitioner, and that's why I always adhere to the concept of functional nutrition, functional medicine, and always look at the body with my chiropractic origins in a functional light. Having said that, I do believe that healthcare has changed. I think that we're going to see more telemedicine. I think that patients are going to want to know what's my health status, and I hope everybody knows that health is wealth. What changes have I made in my personal approach to health and for your patient base? So it's kind of like two questions in one. For my own personal health, well, I've been fortunate by living home. It's virtually every meal. Once in a while we order out, and of course it's a health place. My wife's cooking. So remember, when I'm on the road, I make sure that I bring food, and I make sure I find the organic place. They're great, but they're not as good as eating here. So I think that was the change that I made, a welcome change. I think I got a little more rest, because I think when you're on the road, there's always something to do. It wasn't that I was sleeping too much now. I think I'm getting a little bit more rest. And, you know, the exercise, I think not having access to everything in my home gym made me realize you don't need everything to exercise. And a lot of people are doing something with a lot less. I mean, I saw Arnold drive his car, take a barbell, dump it in grass like outside where nobody was, and he was like, you can do all these one things. And, you know, he's in his 70s, but Arnold still lifts. And he was like, I got to work out. Stallone says I have a little home gym. I'm getting a little older. He's still jacked. He's like, I'm getting it done. So, you know, I think those things, my patient base, I can tell you that everybody's worried about, you know, they haven't seen anybody for weeks. So pain is an orientation. And everybody's worried about, what do I do to make sure I can stay healthy? So patient base definitely is very concerned about, you know, again, where we are, is very concerned about health, immune system, and I do believe that people, when they come back, are going to look to drop the weight and eat a little bit better. So those are the changes. That's not a real change to my patient base. That's something that I've always pontificated, if you will. But I think now patients will, you know, want to adhere to those concepts a little bit more diligently, if you will. How's this? This is a great one. Yeah, thanks for sending this in. How has this changed your subject matter to lecturing internationally to other docs? So, number one, I can tell you that my lectures have gone to Zoom and online. Now, it's changed the way that we've communicated. It makes you a better communicator. Because at the end of the day, you're still right there. They can look, see, and feel you when you're in person. You can always have a sidebar. There is no sidebar in a recorded webinar. You can ask a question on a Zoom webinar. I even turn my camera on. So if anything, number one, it's made me delve into the information even more because I have to share it in a different manner. It's made me a better presenter. I think now you're seeing those who want to get better have that opportunity to get better. Subject matter. I'm lecturing on immune systems like I've never done before. We really didn't talk about the immune system. We talked about gut health and this. I mean, I've just added another chapter to my book, Superhighway to Health, coming out in a few months. And in it, we're talking about the immune system, how to deal with a virus, how Americans have failed their immune system. We failed our immune system. We haven't let it optimize. So we're sharing all sorts of different things with the docs. And I think that immune conversation won't go away. We just took our immune system for granted. And nationally and internationally, the docs have been extraordinarily responsive to those changes because it is the subject matter of 2020, and I believe in beyond. So do we have any shout-outs? Any shout-outs I missed? Anything like that? So everybody's been nice and quiet today. Today's a quiet Thursday. So tomorrow, we'll be back at 1 o'clock. Remember, we're always on from 1 to 1:30. Please like this, comment, share it. We need the shares. We need to get the message. We need you to help us get our message out, the message of health. In addition to that, we'll have some interviews coming up next week. I'll announce them tomorrow. I'm just trying to get the right days. Just again, remember, 1 to 1:30 Eastern Time. We're always on. If you have any suggestions, if you have any requests, I am there for you. Dr. Rob, always yours in health.